The social and economic challenges associated with the COVID-19 pandemic pose a particular threat to Asia's increasing number of elderly people. In this podcast, ADBI capacity building and training economist Pitchaya Sirivunnabood discusses the effects of the COVID-19 crisis on the region's ageing societies and strategies for safeguarding seniors moving forward. Pitchaya, thank you for joining Asia's Developing Future. Can you start by explaining the growing challenges Asia's ageing societies face in the context of COVID-19?
Asia is advancing toward an aging society as the longevity revolution is fostering longer life expectancies due to the medical innovation, improvement in medical care, and healthier lifestyles. According to the United Nations, by 2050, the global number of persons above 65 years old will double to over 1.5 billion, with the largest increase projected to occur in East and Southeast Asia. However, Asia is vast, and the countries within it are all at different demographic stages across the region. The unprecedented acceleration of aging society has highlighted the dire need to strengthen social safety nets so they can provide adequate social protection to the elderly while minimizing physical burden and preserving physical sustainability. The challenge has emerged with the existence of the COVID-19 pandemic. It has caused health crisis, economic crisis resulted from the lockdowns and the travel ban, as well as the humanitarian crisis. The ongoing COVID-19 pandemic has exacerbated many social and economic challenges, which had particularly threatening impact on those in vulnerable groups, including the elderly. In developing economies, older population are the most impacted group, as they face significant risk of developing severe symptoms from the virus and are often financially vulnerable, particularly the elderly who work in an informal sector. In other words, the pandemic can push older people to poverty and isolation. In parallel, in the light of the global health crisis, healthcare systems in developing Asia are immature and must be improved to prepare and ensure adequate support of citizens and healthcare personnel during such pandemics.
What measures could help to strengthen protections for the region's seniors?
The pandemic called attention to the urgency to provide protection for older populations via the creation of effective social safety nets. This includes advancing social and financial protection for the elderly through strengthening social insurance schemes with age-related coverage and the establishment of the social security system for all generations. Without the inclusive and comprehensive frameworks, people's livelihoods, especially in the developing country, will be in jeopardy as they lack the savings, pension funds, and safety net to fall back on after retirement. In addition to the social safety net, the pandemic also highlighted an opportunity for fundamental changes across society. One such sector is the care economy. Two main factors to help further develop inclusive care economy are health education and technological advances. Enhancing knowledge and education of health services, sanitation, and humanitarian support is required. The priority is also to design COVID-19 responses that recognize age-related programs, taking into account the risk faced by the older people. Promoting care and support for the elderly is essential and can be done by investing in universal health care coverage and expanding social coverage to more senior citizens. Adoption of innovative technological advances will strengthen country preparation for a new care economy.
What are your recommended next steps for ensuring the health and well-being of Asia's aging populations in the COVID-19 era?
To ensure social protection for aging population, both in current situation and post-COVID-19 new normal, the comprehensive and inclusive framework for social safety net must be developed. The model of universal healthcare coverage will also play a crucial role, particularly the one that integrates the element related to older persons in social security. This can also be accommodated by strengthening institutions with responsibility for elderly welfare. Opportunity to improve social insurance scheme in both coverage and value to prepare future cohorts for the older age must also be explored, as the pandemic has restrained us from seeing each other due to the social distancing measures. Digital technology has helped to bring us closer. However, to minimize potential digital divide among elderly, Proactive policies are required to ensure the quality of intergenerational relations and socio-cultural support networks. A lifelong learning for healthy aging should also be encouraged for necessary technological skills. Furthermore, leveraging digital technology and platform will promote inclusive care economy for aging society. To establish a strong digital health foundation, 4 factors must be taken into account. These include good governance and robust regulations, development of common infrastructure, adoption of standards and interoperability, and investment and financing in business model and sustainability of systems.
To wrap things up, what more can be done to achieve social protection breakthroughs for seniors in the region?
It is critical to design a policy framework that incorporates elderly welfare to protect aging populations. Institutional cooperation among relevant agencies will smoothen the process and help to achieve the effective policy design. Local and international collaborations are needed to develop inclusive social insurance schemes to provide affordable and comprehensive social safety net to people in the society, particularly those in vulnerable groups. Together, policy dialogues or consultations among authorities, policymakers, and stakeholders will provide a platform to exchange policy experience, best practices, and policy discussions. The outcomes of such discussions can be used to develop successful policy frameworks and implementation in the future. In developing economy in particular, sovereign cooperation is needed to advance common infrastructure and digital technology, such as internet and mobile communication, IT platform, and integrated health information exchanges. Healthcare education is essential for the creation of the care economy as a preparation for aging population in the post-COVID-19 new normal. ADBI and ADBI Institute are continuing our support to the government official from the developing member country on such development in form of funding and knowledge provision, as well as capacity building programs.
This has been Asia's Developing Future, brought to you by the Asian Development Bank Institute in Tokyo. See the show notes for the transcript and related material. For more information about us, please visit adbi.org.